Audio Jungle. Audio Jungle.
So now it's being recorded. Well, today, first of all, I need to introduce myself. I'm Saman Zafar from Pakistan. I am a counseling psychologist and I did my specialization in 2019, last year. And I would like everyone to introduce themselves before starting the topic. Pancha, how would you like to introduce yourself?
Okay. Hello, everybody. I'm happy to be here in this group. My name is Vanja Permulovic. I'm from Croatia, psychologist and Gestalt psychotherapist. I'm in a private practice for 6 years now.
Great. Nice to meet you. Sarah, how would you like to introduce yourself?
Okay, I am Sarah Kenyanjui from Kenya, clinical counseling psychologist, currently practicing in a hospital.
Okay, cool. So who is the next? Who would like to introduce yourself? Pamela, can you hear us?
Yes. Wait.
Kindly a brief introduction, please. Okay. Annie has joined us.
Are you getting me?
Yes, Shamis, we are getting you. Kindly keep your volume a bit low. It's the voice.
That's okay.
Hello, it's not Shamis. How are you?
I'm good. How about you?
Fine, thank you. My name is Shamsa Abdi, aka Shamis.
Okay, Shamsa, kindly give us your brief introduction, please.
Yeah, I'm a counseling psychologist from Kenya,
Cool.
and I practice in the Ministry of State and Special Program.
Nice, interesting. Okay. Annie, would you like to introduce yourself?
Hi, Salman. I'm very happy to see all you. It's my first meet with you. I am hope that my English allow me to understand you very well, and I am very happy. I'm psychologist. I'm from Armenia. Now I am working emergency center, call center, but not as psychologist.
Mm-hmm.
But I love my professional, and for me, always interesting to know new people and new ideas. I am very happy to be with you now.
Cool. We are also very happy to have you with us.
Thank you.
Thank you very much. Okay. So Belinda, I'm going to allow Belinda. We have, mashallah, we have so many people here today. We have 12 participants in this meeting, and it's our third meeting. We are also very excited to have you on board. So who is left? Jelena, would you like to introduce yourself? A little bit of your introduction, please.
Yes, you can hear me, right?
Yeah, we can see you as well.
And I am Jelena Jerkovic. I'm from Serbia, also psychologist and Gestalt psychotherapist. and my English isn't quite bad, so I would like not to speak too much today if it's possible, but I'm glad to be a part of your group.
Cool. We are also glad to have you. Anybody else who wants to introduce themselves by themselves, because we have this iPhone Sylvia here, and I think it's Mari, I'm not sure who is she. And IWIP named person is also here. So I'm asking them to unmute and share their introduction with us.
So can I speak out, please?
Sure, yes, please.
Okay. Hi, everybody. My name is Zan. I'm from Albania. It's the 6th year of work that I work as a psychologist, school psychologist. In fact, I consider my work, of course, the great achievement that I have done in my life, and so I'm so happy really to do this work, and this work I make with my heart.
Cool, interesting. Very welcome here in this group. Thank you very much for your introduction. You're welcome.
Thank you.
Okay, so if anybody is left to introduce themselves, Verena, would you like to introduce yourself, Verena?
My name is Verena. I'm originally from Germany, but at the moment I live in England. I work as an assistant psychologist in what we call the IAP movement. So it's basically improving access to psychological therapies.
Interesting.
And I do telephone assessments and also online workshops with the clients. And it's the first assistant psychologist position I've been able to get, because it's very difficult to get the position, and I really enjoy it.
Great. Very, very congratulations on this position, and I hope you'll enjoy. Okay, guys, so let's get started on our today's topic, that is narcissistic personality disorder. And I would like to begin this topic with a simple definition of narcissistic disorder in DSM-5. It's a preoccupation with fantasies of unlimited success, power, brilliance, beauty, and it's a belief that can be understood by a person associated with the high status people of institution, and it's basically a grandiose, self-grandiose, lack of empathy, and in the DSM-5, let me start with the DSM-5. I gave my own impression of this disorder, but I should share with you the DSM-5's criteria. According to this criteria, the definition states that it comprises of persistent manner of grandiosity, continuous desire for admiration, along with lack of empathy. And it starts by early adulthood and occurs in a range of situations by existence of any 5 of the next 9 standards. So there are 9 standards. A person has to be on at least 5 standards to be diagnosed as narcissistic having a narcissistic personality disorder. So let's start with grandiose. It's a logic of self-importance. Anybody would like to add anything in it? Has anybody seen any of their patient of this personality disorder or a victim of narcissistic personality disorder?
I haven't seen a patient, but when I was growing up, my father was diagnosed with a narcissistic personality disorder or narcissistic neurosis.
Hmm. It's I'm feeling very it's very sensitive, and you are a very strong, encourageous lady to come up with this information. Thank you so much for sharing us. Would you please elaborate? How did you find him?
Um, I, as a child, I never kind of knew what side of him I'm gonna see day to day. And when I did nice things for him, like saving my pocket money to get a Father's Day gift or something, the response that I got wasn't very happy. So as a child, I found it very difficult to understand. But then when I got older, I read up more on the personality disorders, and also chose to study psychology. And I've been now able to understand him much more. It doesn't make it hurt less, but it's one of those things that is part of my life.
Right, right. So you are, I really want to appreciate you. If I were there, I would hug you, would give you a big, big hug. You're very strong, being very vulnerable in front of the group of 12 people. And I have also observed such traits in people around me. Uh, I'm a little bit afraid to declare here, because I feel that it's going to be a YouTube channel, and you are a very courageous person, you shared, but I can share anonymously that I have seen this lack of empathy and the cold stare, and it certainly hurts a person if he has not developed this understanding of narcissism. Person feels something is wrong with him or herself, that they are behaving like that. So, and the second point, Vanja, would you like to share anything about it? I'd like to allow other people to share their knowledge. Vanja, hello?
Hi.
Yeah.
I'm not sure if you're referring to me. Well, I don't have clients with narcissistic disorder that is diagnostic, but with personality traits, yes. I think that we can see that traits and tendency to narcissism in a lot of people around us, even in ourselves sometimes. So since I work with organizations as well, there are some CEOs and some persons of authority that sometimes have those traits, like feeling of power and entitlement, and sometimes envy of other people and their skills and traits that can be sometimes better. And this is the part I see in my reality.
Okay, cool. Very nice. So anybody else, anybody want to volunteer to add anything in this discussion? Sarah, Shamsa, Lina, anyone? Okay, I should continue with that. The grandiose was the first topic, the first theme in this narcissistic personality disorder is the logic of self-importance. There is a healthy self-esteem, which all people have normally, generally, but when they have that is not the toxic grandiose of self-importance. They feel that nobody is like them. They are different from others. They feel that nobody is like them. They are different from others. They feel that nobody is like them. 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 They are different from others. So it's hard for them to relate with other human beings, other people. They have also the fixation with fantasy of infinite success, control, brilliance, beauty, and idyllic love this, that they're going to have, that they lose their grounds with reality. They stop seeing other people. They're so full of themselves. And there is another point, that is, they have a desire for unwarranted admiration. They cannot hear anything against them. Like, it's hard for them to face the criticism. Anyone in the group would like to add? Barbara, you are also here with us, Barbara. We didn't know. Hello, Barbara, can you hear us? Belinda, Pamela. I'm feeling like a class teacher. My students are not speaking up. Cute. Okay.
No, someone, I'm here, but I can't understand the whole topic it very well. But it is very interesting, and when talk about our experience, it very interesting.
Thank you, Annie.
Just I can't understand very well because my English don't give me that opportunity to understand very well. But it is very interesting to me listen all you.
Okay, thank you so much for appreciation and for your feedback. So I should keep starting, or should I keep encouraging you guys to speak up? Don't feel shy. It's like a drawing room meeting. We are having informal discussion.
Hello.
Hi, Barbara, I guess your internet.
Hello.
Gigi. Yes, Barbara, we can hear you.
Oh, my internet. My internet is poor, but I'm happy to be here. And since I've just joined, I will come in later to give my comments. Otherwise, thank you very much for the discussion.
Thank you, Barbara. Good. So we were discussing the points, the individuality, self-direction, empathy, and closeness. They have the issue with these things. They have resentment of others, or a conviction that others are resentful to him or her. So this is a fear that other people are not happy with them. So somehow deep down, they know the people with narcissistic personality disorder, they know that they are causing harm to others, but they cannot rule out the real reason behind it because they lack empathy. They cannot feel what others are feeling. So this is the point where we cannot call them toxic or villains, because things are going on the neurological pattern. There is a display of egotistical and conceited behaviors or attitudes. So when they think they are doing something harm, they try to hide it, and that make them conceit their the information from other to make them vulnerable and to make them look down, look smaller than them. So uh, anybody wants to share how narcissistic personality is being observed in their culture? I think the characteristics are somehow different in different cultures. So Sarah, and you, would you like to add, would you like to tell how in Kenya can you see the people with narcissistic personality disorder? What kind of symptoms they show?
Yeah, okay. Yeah, here in Kenya, where I am, we've not really made a diagnosis of narcissistic, but mostly grandiosity, and yeah, they require a lot of praises, so such characteristics.
Okay. Like you don't have this clear, you have not seen any person with narcissistic personality, like, okay.
Yes, yeah.
So we can read through the DSM-5 the epidemiology. The epidemiology of this disorder, it's more prevalent in males, and it's more common in men. And 18% of males presenting with NPD compared to 6% of females. So in a total population, according to the research in 2013, they have found that 18% of total males were presented with NPD. So there is a lack of diagnosis as well. People don't go out, and they don't make them convinced to see the therapist. This is the major issue with personality disorder, that people don't get convinced. They think that they are all right. Problem is with others, right?
Yeah.
Uh, okay. Thank you so much, Sarah, for your contribution in this thing.
Can I say something?
Yeah, Vanja.
Oh, well, you asked about different symptoms, if I understood right, from different cultures. For me, it's if we are talking about the diagnosis, then I think that the symptoms from DSM are the same regardless the country. But for me, it is interesting to see how we live in the society today all around the world that has narcissistic traits in people, in all of us. So without diagnosis, it's for me it's interesting to see how narcissism is feeded in the society. I'm liking the word now. We are building bigger houses. The children have unique names. It's really important to have unique name now these days. So there are a lot of reality shows. Everybody wants to be a brand. It's really important that you yourself is a brand. So it's in the society all around us, and that's for me really interesting to talk about, because how it all started in 17th and 18th last century, when it all started with you have your rights, you have your right to be yourself and freedom, and it was emphasized like that. And those people, self-admiration and self-admiration became a problem now these days.
Yeah.
And it's interesting now, but I don't want to go into that, but maybe just to think about it later, how this pandemic all around the world gave us the opposite. Humbleness and caring and empathy and connection with others and everything that the society all around us didn't have these days. So that's for me interesting.
Yeah, thank you very much, Vanja. It's a very interesting point she has raised. She has told that how our yes.
Sorry, I want to add Vanja when she says that it is self-admiration. Yes, it is because, but I think that must have its limits, because when we self-admiration, self-confidence, which is out of limits, it's become problem for us and for our social. But self-admiration, self-confidence is very important for our life and our personal growth.
Okay. Annie, I'm getting what you're saying. You're saying that it should be healthy. There is a healthy balance between too much grandiose and good self-esteem or good self-admiration, confidence, right?
Yes, may I can't utter my thoughts correctly, but yes, I agree with you.
Thank you so much. We are getting what you're saying, and thank you very much for speaking up. The problem that our friend, our dear fellow Vanja raised, it was that our society somehow starts appreciating the narcissistic trait more than the non-narcissistic traits. Like, but that fame is temporary. Whenever people get to know the toxic side of their personality, they start leaving them, and that is why narcissistics are very alone. They feel very alone because they cannot build a healthy relationship. Um at some point, when people start to have understanding about the main values or the sanity, peacefulness of their mind, they start understanding the difference. This is my point of view. Let me add Jane. Jane has also joined us. So we have 13 members in the meeting. Okay, so treatment. We're going to discuss the treatment of narcissistic personality disorder.
Okay, just before we go to treatment, kindly.
Yes, Sarah, sure.
Just before we go to treatment, I would want to add something. Now, some theories states that the caregivers might not have treated the child, appropriately. For example, like being overly critical or praising the child too much, and yeah,
Mm-hmm.
and admiring the child too much, so that can cause can make the child have feelings of grandiosity and something of that sort. Thank you.
Okay. Thank you, Sarah. But the thing is just that this personality disorder is diagnosed in adults, not children. So if you're saying if children are showing the traits, we should treat them with humanly, right?
Yeah.
Okay.
I may add something, and I'm not sure if Sarah meant that, but if we're talking about development of narcissism, how the parents or the significant other raised the child and it became narcissistic. So it's like when their mothers are depressed or hysterical, cold, distant, neutral to the needs of the child. That can be something that the child doesn't learn. I have something in myself that is really worth and of value and interested to my mother or father. So I have to suppress that inside myself and just be a false me, something that my mother will see and adore, and that my needs are not important. So I have to be successful, beautiful, and smart and everything that to be loved. Okay. So that is how from the child perspective it is developed.
Right. Thank you, Vanja. Very brave, another courageous. Mashallah. I'm very happy to hear you guys, and it gives me immense pleasure to know the inside stories and the personal experience of this thing. I have also experienced this, and I have seen my relatives. It is very common because, as you said earlier, that our society appreciates the narcissistic trait. So parents get to develop their child in a way that they make them feel that you are only lovable when you fill this, you get this certain standard of this, but they never make you feel satisfied, they never make you feel happy, because they feel if they will appreciate, the child will stop progressing. It's their fear that makes the children feel unlovable, and it can make them, it can certainly hurt them very bad, so they get to need, they get to feel they need the to have their own therapy. They want to keep to take their parents to therapy as well, and some get successful as well. So there are many success stories, and out of this pain we have this, we have developed this the strong connection, and to share the knowledge with each other to feel sane and grounded. And should I start with the treatment now? Anyone else would like to add anything? Barbara, Belinda, Jane, Jelena, Lena, Pamela, Shamsa. We have so many cool ladies here.
Well, I would like to say something that is similar to Sarah's and Vanya's opinion, and that is actually that for example, in Gestalt psychotherapy, we believe that people are born healthy with all potential to be fully human, and that before the age of in a not so healthy and so perfect environment, we actually have to make some adaptations of ourselves to survive. And we call that in a Gestalt creative adjustments or creative modifications, with the idea to destigmatize it. And we believe that actually all personality disorders have their root before the age of 3. And I can suggest one good book from Dr. Eleanor Greenberg. She's a psychologist and a Gestalt psychotherapist. Title of that book is Borderline, Narcissistic, and Schizoid Adaptations. And the subtitle is The Pursuit of Love, Admiration, and Safety. So I believe that I believe that this kind of creative adaptations that we build in our childhood, someday when we grow up, this kind of temporary adaptations actually, and then when this kind of habit is more so functional in our present time, we actually go to, for example, to psychotherapy. And here we are in our treatment of narcissistic disorder.
Thank you
That's
so
it.
much, Jelena. I would like you to share the name of this book in the group as well, so we will be able to read it. We would love to read that book you mentioned. And
Okay, I will. Unfortunately, I don't have that book format, but I will write our group. I can say one more time, Dr. Eleanor Greenberg, Borderline, Narcissistic, and Schizoid Adaptation. And in that book, she asks what we choose and what we want from person that we want. That is, for example, love, nurturing, and it isn't connected with the borderline disorders. And if we want the sense of safety and interpersonal safety, then it is connected if we need some admire and admiration,
Right.
feeling special, etc. It is connection, but that in
Hello. Okay.
That's it.
Thank you. Thank you so much, Irina. Thanks a lot. I think this topic is so vast, it is difficult to cover it in one session. It is a vast topic. And as you said, that we should be differentially diagnosed with other personality disorders like antisocial personality disorder, borderline personality disorder, and histrionic personality disorder. In even DSM-5, they have mentioned that we there are similar characteristics with the other three cluster B personality disorder that I have mentioned. And there is another thing that they are needed to be tested for their alcohol abuse or substance abuse. Because of this pathology and lack of therapy, they would like to do something with their own um, issues. So most of the people, if they don't see therapists, they start taking medicines on their own, or they go for the substance abuse. Okay.
Hello.
Yes, Barbara, we can hear you.
Yes, I have personally seen this among the addicts that I handle. You realize when they're young, their mothers pamper them too much. As they grow, you see these parents who go to school and try to show the children that they are really special. They want to bribe the teachers. As when they reach adulthood, these are the people we handle in rehab. They use their alcohol away from others. They separate themselves from the rest of the community, and they start abusing drugs. They don't care about their, for example, there is one I know I was handling some time back. He doesn't care about his mother, who has tried her level best to show him that she really loves him too much. He doesn't care, he doesn't mind. So it is common in people who are using drugs, and I have seen it really in the clients that I handle. Thank you.
Thank you, Barbara. Very interesting. So let's share about we have discussed the basic definition, the descriptions, personal experiences, and differential diagnosis of narcissistic personality disorder. So if we go into the therapy, yes, anybody would like to add anything?
Yeah, I wanted to add something. Yeah.
Sure.
Yeah. Most of these people who are affected with narcissistic personality disorder have problems in anything they perceive criticism. They become impatient or angry, have significant interpersonal problems, react with rage and contempt, experience major problems dealing with stress and adapting to change. feel depressed and moody because they fall short of perfection. And I think all this comes when they don't get the attention they need because they feel they are superior than others, and that people should go along with what they deem it's right with them.
Yes.
I think that is all that I have to add today.
Thank you, Shamsa. You have basically sum it up. You have sum up the discussion we had earlier. So the problem is this, that when they've hit the rock bottom, like they lose the relationship or they lose their job because of this behavior, or when their children or their parents, their relatives, their family members, or even their colleagues start telling them that this is not right that you are doing to us, you treating us very coldly, or you cannot hear the criticism. It's the time that they feel, yes, there is something wrong and they need to see the therapist to feel the deeper connection with others. That's the time that they need therapy. The lady with the IWIP name, sorry, I forgot your name. Hello? IWIP. Yes. Can you please tell us your name?
My name is Anne. My name is Anne.
Anne. A-double-N? Anne?
Yeah.
Yeah. Okay.
Anne. Yeah.
I should remember it. So
there in Albania, we tried this disorder personality. In fact, just a second. Like a bipolar structure, in fact, that comes early in life. I don't agree the age that Yelena says from three years. In fact, no, there doesn't try in this cause. So the self starts to be bipolar structures, as I was saying, as early in life, and so we work hard with the parents in this cause that things, please, with child, give some warmth, empathy, and so they are creating a healthy self-esteem for the child. So in fact, I didn't have any clients, to be sincere, with discarded personality, but in literature we tried in these forms like a bipolar structure.
okay. Thank you, Anne. Yes.
I have to say something, please. So if a friend calls calls them and say, we are going at cinema, example, and they have an accident to them and they cannot go, of course, in cinema, they worry about losing the cinema, not for the whole of the others. So they choose the friend with interest, I think, and their feelings towards them change depending on relationships from the others, of course. They have social problems, let's say.
Right. Thank you so much, Anne. I know we are from.
I'm sorry for my English because we don't. Oh my God.
It's okay. It's all right. It's okay.
If I may add something.
Yes.
About criticism.
Yes.
Use is the words that missing me.
It's okay, and we got your point. We got your point. You shared the point about children having narcissistic traits, right? And you gave the example of
Yeah.
cinema that somehow.
Yes. Example for our culture, in fact.
Right,
But
right.
I don't know really. Okay.
Thank you. Vanja was about to say something. I should not cut her. Vanja, kindly continue.
Okay, can I?
Sure.
I wanted to say something. I'm getting this feeling that we are talking about narcissism as a diagnosis is something that it's not that they are doing that on purpose. It's a way of being that it's known to them. It's developed. It's the only way that they could feel loved when they were younger. It's from Gestalt perspective. So now it's the way that they function in the world, and they are not happy about it. In fact, it's because lacking a real self. Who am I, and what am I? What are my true values and worth in narcissistic traits? So I don't mean myself. But so the clients don't know that, and if you confront them, it can raise shame. Shame is the main emotions behind that. So when you give them critic about themselves, they see the whole self. Healthy personality feels the critic as a part of feedback and something that I can see as just a part of me. But narcissistic personality feels everything is wrong with me when you give them critic. And since they need to be loved when they're at their best, so they're feeling a lot of shame inside. That's why they're so sensitive about critics. I'm not sure if I explained it really well. Do you know what I mean? Yelena is not nodding.
Thank you. Thank you very much. It's very insightful information I'm getting. And I feel 1 hour is too less for this. And, and we are about to have only 10 minutes, rather 8 minutes left. I think we should not discuss the treatment here. We can continue with this, and we will do the rest of the discussion in any other session. What do you guys say about it? Do you agree with
I
me?
think it is, yeah, I agree with you.
Thank you, Pamela.
It's my first meeting and I've learned a lot because I realize narcissistic disorder is characterized with the overlap with the histrionic and borderline disorders. They both have some characteristics like poor relationship, because for narcissistic disorder, they want that attention. If you don't give them praise, they would rather ignore you than you rejecting them. So they don't establish a firm relationship, and they are fearful they may be rejected if they don't get what they want themselves.
Right. So they're very vulnerable. They, in their own mind, they are vulnerable of being
Yes.
criticized, right?
Exactly. Yeah.
It's sometimes NPD patients, NPD, I mean to say narcissistic personality disorder patients commonly have other psychiatric ailments such as depression, anxiety, or other mood disorders uh, because of this behavior or this feeling of not being loved without condition. So they develop these other psychiatric illness with NPD. the use of hospitalization ought to only be used as a short-term method. Majorly, they are being treated through psychotherapy, and in that they have long-term this monitoring their social impact, and psychotherapy helps them a lot in understanding their own fears and shame issues, as Virana, as mentioned by our friend Vanja or Virana. I hope I'm not mixing them. Their names are same. No, 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 sorry. Vanja and mentioned. Virana did not say anything. Virana, would you like to add in our last 5 minutes anything?
I was just thinking about an example when I think I was 11 or something. So my father used to play squash quite often with his friends, and he was getting ready to go, and my mum was ill, and she had a fever of about 42 degrees. So she was in bed and couldn't look after us. And instead of being understanding and just saying, okay, I won't play squash, he basically started being really horrible to her, saying, oh, you can look after the children. There's nothing wrong with you. Get up. I don't want to miss my squash match. So that's what all he was caring about. So the point about the cinema, really, I identified with that point.
Thank you so much. You gave the second example of how their own needs are very important to them and others seem invisible.
Yeah.
And that hurts the most, even the person who is doing it and the other person who is facing it. I hope we have shared enough information, our knowledges regarding NPD with each other. Then thank you so much for coming, for joining. It's the first time I have 13 participants. It's a success story at WIP. So I'm very happy, and I would like to say we will, inshallah, we will meet again and we will have another topic. Thank you very much, courageous, brave
Thank
ladies.
you to Saman and all of you. It is very interesting. And I can't utter my thoughts very well, but as you all say, it is narcissistic disorders. It is a problem, and that persons can't to look for self or own self, and for her for his life it be problem. But as you say, they have been allowing and accept it because it's important, all of you, because we all live in social and oh, sorry, I can't say my thoughts, but it's very important be in social and feel that you can be part of social. So thank you, all of you. I hope that we meet again. Thank you for the discussion. It is very interesting for me. I can't understand and talk more, but it's very interesting and important to me be there.
It's our pleasure to have you, Eddie. It's our pleasure. Anyone else? Thank you very much. Should I say bye-bye to everyone? It's 1 o'clock already. And Vanja,
Best
would you like?
regards from Albania. Thank you for this opportunity.
And you're welcome.
Bye.
Bye.
Thank you for the meeting.
Thank you, and I look forward to the next meeting, and maybe we can talk about treatment.
Thank you for having us.
You're welcome, guys. You're welcome. Everyone, take care. Have a good day. Good night. Bye-bye.
Good day.
Bye-bye.